We've upgraded our PAPRs, or the powered air purifying respirators. They're located on Medic 42 on the passenger side, directly behind the cab. Both PAPRs are inside a red toolbox located inside this door. Let's take a look at the new PAPRs.
Now we're going to put on our first pair of gloves. Do this as you normally would. It does not need to be done in a sterile fashion. Make sure that the cuffs of the gloves go as far up your arm as possible. Now you're going to put on your coverall. Please inspect it and make sure there are no holes or tears. Take your time. Put the coverall on slowly and methodically.
If available, coveralls with thumb hooks help secure the cuffs of the gown over the inner glove to help ensure there is not a gap between the glove and cuff of the coverall. Put on your coverall with the zipper in the front. Pull up the zipper completely. Ensure the coverall is large enough to allow unrestricted freedom of movement. Ensure cuffs of inner gloves are tucked under the sleeve of the coverall. If a coverall with thumb hooks is not used, facilities may consider taping the sleeve of the coverall over the inner glove to prevent potential skin exposure from separation between the sleeve and inner glove during activity. If taping is used, a tab should be created by folding the tape over at the end. This tab will help facilitate easy removal during the doffing process. Care must be taken to remove tape gently. Experience from some facilities suggests that taping may increase risk by making the doffing process more difficult. Attach the hose to the PAPR battery pack and filter. The trained observer will hold the respirator at the small of the back, while you fasten the belt around your waist snugly and secure any loose straps. The PAPR battery pack and filter unit should be on the outside of the gown to ensure proper airflow.
Now you're going to put on your outer gloves. If you need help with this, just let me know.
Put on the second pair of gloves with extended cuffs. Some facilities may choose to use outer gloves of a different color to easily identify rips or tears. Ensure the cuffs are pulled up and over the sleeves of the coverall.
When putting on these gloves, make sure that the cuffs extend as far up your arm as possible.
Double gloving provides an extra layer of safety during direct patient care and during the personal protective equipment removal process. Put on the single-use PAPR hood so that it fully covers the neck and extends over the shoulders.
You're going to put on the hood so that the opening is in the front.
Be sure that the hood covers the head and all of the hair, neck, and ears, and that it extends past the neck to the shoulders. The trained observer will turn on the PAPR and attach the PAPR blower tube to the PAPR hood and make sure that the tube is snapped and fits. If a PAPR unit should stop during patient care, you must leave the patient area immediately. The trained observer should do a final check that all areas are covered and no hair is protruding from the hood.
Now I'd like you to disinfect your outer gloves.
The first thing you will do is use an EPA-registered disinfectant wipe or an alcohol-based hand rub to disinfect your outer gloves. The wipe will be used to remove any visible contamination. If you're using an apron, you now need to remove it. The assistant will assess the type of apron used and will assist with untying the strap. Then, you will remove the apron by breaking the strap or lifting the strap over your head, rolling from the inside to outside and away from your body, and discarding it in the appropriate receptacle. If the apron can be gently pulled away from the body by tearing it at the neck, this process should be used. Once the apron is off, inspect your personal protective equipment for visible contamination, cuts, or tears. If you see your personal protective equipment has been compromised, or if there are any signs of contamination, disinfect it with an EPA-registered disinfectant wipe.
In the next step, you're going to remove your outer gloves. Please do this slowly and carefully to avoid contaminating or tearing your inner gloves.
In this example, the boots are under the coverall and are being removed later in the sequence. However, depending on the personal protective equipment used at your institution, the boot cover may be removed at this point in the sequence or later on in the sequence. Now it's time to remove the outer gloves. There are two very important things to remember. First, pay special attention so that you don't contaminate or tear the inner glove. Second, Don't snap the gloves, which could cause spray. Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then, roll it down until the glove is completely off your hand, in a ball, in the palm of the other hand. Then, slide a finger down and inside the outer glove on the other hand, and pull it off until it's balled around the first glove. Dispose of the gloves.
Okay, great. Now disinfect your gloves.
Now, use your EPA-registered disinfectant wipe or alcohol-based hand rub to disinfect your gloves.
Now you're going to remove your respirator. The assistant can help you with this.
In this step, you will take off your belt-mounted respirator. How you do this will vary from model to model of PAPR, so you and your assistant will need to refer to the manufacturer's specifications.
The assistant will detach the hose and turn off the system now.
Although the specifics will vary, you should do things in this order. First, the assistant will detach the hose from the hood. Then, while the assistant holds the belt unit in his or her hands, you will unclasp the belt. Place all reusable PAPR components in a designated area or container for later disinfection. Next, you will take off the hood. The assistant will stand behind you and grab the outside of the hood, and roll the hood up towards the top of the shoulders, forming a cuff. When your assistant tells you to do so, you will grab the hood near the ears, bend forward at the waist, and pull the hood slowly and methodically down and away from your head until it's at waist level. Discard the hood into the trash receptacle. It's very important that you don't touch your face after removing the hood.
Please disinfect your gloves now.
Now, use your EPA-registered disinfectant wipe or alcohol-based hand rub to disinfect your gloves.
Next, you will remove your coverall. Start by unzipping it completely, and your assistant will help guide you from there.
If your coverall has a flap covering the zipper, you must gently pull it open. Then you will need to disinfect your gloves. Next, tilt your head back and reach for the zipper at the top of the suit, using a mirror to avoid touching the skin. Grasp the zipper with 2 fingers of one hand, without using the other hand, on the front of the suit, and pull down. Unzip completely. The assistant may help you unzip the coverall if necessary. The assistant will stand behind you and grasp the outside of the coverall at the shoulders, and pull it off your body in a downward motion until the coverall is off your shoulders completely. The assistant will then reposition his or her hands and roll the suit outward and down the back in a controlled fashion, removing your arms and slowly pulling it down until it's at your waist, being careful not to touch your scrubs or skin.
Be sure to move slowly and deliberately to avoid contamination of any exposed surfaces.
To get the coverall off the rest of the way, you may need to sit down in a clean chair, which will be marked clearly. Grab the coverall and pull it away from your body, one leg at a time. Once the coverall is off completely, dispose of it.
You're doing great. Now go ahead and disinfect your gloves.
Now, use your EPA-registered disinfectant wipe or alcohol-based hand rub to disinfect your gloves.
Now we're going to remove your inner gloves. Be careful to do this slowly to avoid tearing the gloves or contaminating your hands.
Now it's time to remove the inner gloves. Like with the outer gloves, there are 2 very important things to remember. First, pay special attention so that you don't contaminate your hands. Second, don't snap the gloves, which could cause spray. The process to remove the inner gloves is the same as it was with the outer gloves. Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then roll it down until the glove is completely off in a ball in the palm of the other hand. Then, slide a finger down and inside the glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves. Once your gloves are off, it's very important that you don't touch your face, any exposed skin, or any surface in the room.
Go ahead and perform hand hygiene.
Next, perform hand hygiene using alcohol-based hand rub on your bare hands.